The committee has advised me that, in its view, COVID-19 remains a global health emergency, and I agree.
About the latest statement made by the World Health Organization about COVID-19 remains an emergency. However, we are seeing countries are making their different approaches to this global health emergency. What does that mean?
So the decision that was made, or the advice that was given to us by this independent emergency committee, was for the world. It's global advice, and it says this is where the global situation is, and the global situation does remain a public health emergency of international concern. But we do recognize that different countries are at different stages or have different situations in their own communities. So no country will be exactly at the same point. But this was a characterization of where we are as the world.
Now, I'm sure, Dr. Harris, you have also been hearing from the Chinese side stating that the current wave of COVID-19 is, quote unquote, coming to an end. Now, how is WHO, your organization, looking at these different statements and approaches by countries of WHO, member countries of WHO?
The numbers coming out of China suggest that now the surge is passing. That's very good news, especially for the Chinese people, so that they can at least enjoy the time together during the Spring Festival. But it doesn't mean that you say it's over. It means that you still must be vigilant. You still must be watching what happens next. This is an unstable virus. It keeps on tricking us. So we all have to really remain vigilant.
Transition, of course, is another key word I pay attention to in the statement put out by the WHO. You know, what does that mean eventually? How is that going to be defined?
There are not official laid down criteria. And one of the reasons for that is that every public health emergency of international concern we've had has been very different. So we've had quite different ways in which a transition has occurred. For instance, for Ebola, it's quite often after all cases are finished and there were clear criteria. But for other diseases, the criteria were not set hard and fast. So again, that's why each of our emergency committees that advise us on this are all made of different people. They're not the same committee. There are people with that kind of expertise who can say, now, this is where we are now. This is why we think, looking at the global data, that we're moving into this phase. And that's the advice they give the Director General, Dr. Tedros. And he is actually the one in the end who says, okay, yes or no.